Diuretics are a class of medications that increase urine production, a process known as diuresis. Due to this effect, they are often called water pills. Diuretics affect osmosis by acting on the nephron, or the functional unit of the kidney, leading to diuresis. Therefore, to understand diuretics, it is essential first to grasp the function of a nephron and the concept of osmosis. The kidneys consist of approximately 1 to 1.5 million nephrons each. They filter blood to eliminate waste and maintain fluid and electrolyte balance within the body. The nephron has several segments, each with a unique role in this process. These include the renal corpuscle, the proximal convoluted tubule, or PCT, the loop of Henle, the distal convoluted tubule, or DCT, and the collecting duct. Osmosis is the passive movement of water across a semi-permeable membrane from an area of lower osmolarity or lower solute concentration to an area of higher osmolarity or higher solute concentration to achieve equilibrium or balance. While many molecules contribute to the osmotic gradient, or the difference in osmolarity across a semi-permeable membrane, sodium is particularly significant. Water tends to follow wherever sodium goes. Osmosis is crucial in the kidneys for water reabsorption, or the movement of water from the filtrate back into the bloodstream. Diuretics alter osmotic gradients within the nephron, decreasing water reabsorption, leading to diuresis. There are 5 main types of diuretics, each acting on a different segment of the nephron. These include Osmotic Diuretics, Carbonic Anhydrase Inhibitors, Loop Diuretics, Thiazide Diuretics, and Potassium-Sparing Diuretics, which can be categorized into Aldosterone Antagonists and Epithelial sodium channel blockers. If you want to learn more specific information than mentioned in this video on any of the mentioned diuretics, you can click the link on screen or in the description below. Osmotic diuretics primarily act on the PCT and the loop of Henle, which are highly permeable to water and play a crucial role in water reabsorption. These diuretics increase the filtrate's osmolarity, creating a strong osmotic gradient that reduces water reabsorption. As a result, they lead to aquaresis, or significant water loss, with minimal impact on electrolyte levels. Mannitol is the most commonly used osmotic diuretic. Carbonic anhydrase inhibitors work on the PCT, which is responsible for the reabsorption of bicarb, sodium, and water, using the carbonic acid bicarb buffer system. These diuretics work by inhibiting the enzyme carbonic anhydrase, which plays a crucial role in this buffer system. When carbonic anhydrase is inhibited, bicarb and sodium cannot be reabsorbed, so they remain in the filtrate. As a result, water also stays in the filtrate and is not reabsorbed because the osmotic gradient does not change. Remember, water tends to follow sodium, and since the sodium did not move, water will not be reabsorbed either. This process leads to the alkalization of urine and a mild diuretic effect. Acetazolamide, methazolamide, and dichlorphenamide are the most commonly used carbonic anhydrase inhibitors. Loop diuretics act on the loop of Henle, which is responsible for the reabsorption of sodium chloride and water. These diuretics inhibit a cotransporter located in the ascending limb of the loop of Henle. This cotransporter is responsible for moving sodium chloride from the filtrate into the surrounding medullary interstitium for reabsorption. When this cotransporter is inhibited, the movement of sodium chloride into the medullary interstitium decreases. As a result, the osmolarity of the medullary interstitium is reduced, decreasing the passive movement of water into the medullary interstitium from the descending limb of the loop of Henle for reabsorption. The result is significant diuresis. Furosemide or Lasix is the most commonly used loop diuretic. Thiazide diuretics, often called low-ceiling diuretics, act on the early DCT, which is responsible for sodium, chloride, and water reabsorption. These diuretics inhibit a cotransporter that is responsible for reabsorbing sodium and chloride. This reabsorption of sodium and chloride normally creates an osmotic gradient that allows water to be reabsorbed through osmosis. Therefore, inhibiting this cotransporter causes sodium, chloride, and water retention in the filtrate. The overall effect is mild diuresis. Hydrochlorothiazide is the most commonly used thiazide diuretic. Aldosterone antagonists, also known as mineralocorticoid receptor antagonists, are one of 2 types of potassium-sparing diuretics. These diuretics act on the late DCT and the collecting duct. They block the action of aldosterone, a hormone that normally increases sodium reabsorption in exchange for potassium secretion, or the movement of potassium from the bloodstream into the filtrate. The movement of sodium creates an osmotic gradient, which water can follow. By inhibiting aldosterone, these diuretics help retain potassium in the bloodstream and sodium and water in the filtrate. The overall effect is mild diuresis and reduced potassium loss. Spironolactone and eplerenone are the most commonly used aldosterone antagonists. Epithelial sodium channel blockers, also referred to as ENaC blockers, are one of two potassium-sparing diuretics. These diuretics act on the late DCT and collecting duct. They block epithelial sodium channels, or ENaCs, which normally facilitate sodium reabsorption into the cells lining the nephron. Sodium can then be reabsorbed in exchange for potassium secretion via sodium-potassium ATPase pump. The reabsorption of sodium creates an osmotic gradient that allows water to follow. However, when ENaCs are blocked, it causes sodium and water retention in the filtrate and potassium retention in the bloodstream. The overall effect is mild diuresis and potassium retention. Triamterene and amiloride are the most commonly used epithelial sodium channel blockers. Diuretics are mainly used for their ability to reduce fluid volume in the body, which can be helpful in the treatment of hypertension, heart failure, edema, and some kidney disorders. The most common adverse effects of diuretics include electrolyte imbalances, such as hypo or hyperkalemia, dehydration, dizziness, and hypotension. Diuretics should generally not be used with anuria, or the absence of urine production, severe dehydration, or certain electrolyte imbalances depending on the specific diuretic. And finally, some special considerations. In general, diuretics should be avoided before bedtime to prevent nocturia or the need to urinate during the night. Many diuretics contain a sulfa moiety, which can, in rare cases, lead to cross-reactivity reactions in individuals with a sulfa allergy. Those taking diuretics should be advised to stand up slowly to avoid falls, and to sit or lie down if experiencing symptoms of hypotension. Additionally, routine bloodwork may be necessary to monitor for electrolyte imbalances. I hope you found this video helpful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!